Hi all, in this video, I'm going to explain about the Indian healthcare system. In the last previous video, I had explained you about the Indian healthcare industries, what are the supporting industries for the healthcare sector. At the same time, what are the different components are there to support healthcare industries as well as what are the challenges they are facing. In this video, I'm going to discuss you about the overview of Indian healthcare system. Basically, right, healthcare system is talking about, right, a way of giving services, especially related to healthcare to the patients. Now, here, the system, or it can be, we can call it as a process or the procedure, right, which is followed in Indian country with respect to healthcare is very diverse and it's a very important components of Indian healthcare services. Now, here in this Indian healthcare system, where it is provided by both public and private sectors, and both the sectors are providing a wide range of services in order to prevent and take care of the people with respect to their health. If you see the initiatives taken by the Indian government, they have done or they have initiated lot of healthcare related programs and they have exclusive missions with respect to healthcare services with the support of hospitals, private hospitals, healthcare centers, communities, rehabilitation center, and so on, to ensure that they are providing 100% delivery to the patients. At the same time, so you can see, right, our Indian healthcare system is right having a multiple system, multiple process, and we are good in giving a treatment. We have a very good skilled doctor. We have very good resource. We have very good infrastructure and we have very good way of dealing the peoples with the latest machines and equipments. And also, each category of peoples are really happy that they can able to access the service provided by the Indian hospitals. So this shows that how a system is followed in India with respect to healthcare sectors. Now, this is some of the uh, important the layout, the chart of how healthcare services the system is followed in India. As I already mentioned, we have both public and private sector. Under public sector, we have all this primary healthcare center, community healthcare center, hospitals which is located in the rural, urban, semi-urban districts, taluks, right? So all these are a part of a private public sectors, where it is categorized in a three different way. One is under the Ministry of Health, all the government hospitals, all the primary healthcare centers is part of a Ministry of Health. There is exclusive hospitals, there is exclusive centers, there will be exclusive clinics for defense, like army, as well as for the railways. But when you come to the private sectors, right, private sectors are categorized in a two different way. One system is right a profit-based corporate hospitals. Another system is a non-profit organizations where it is supported by the trust, charitable, or any religious-based, community-based hospitals. Right? Whereas profit-based hospitals are comes under the corporate hospitals, like normal private hospitals, specialty hospital, multi-specialty hospitals, a private clinic, and so on. So this is the pattern, the system which is followed by the Indian healthcare systems in our country. This is the level of healthcare systems followed in India. Primary level, we have a PHC, primary healthcare centers, community healthcare centers. Secondary level, all these hospitals located in districts, taluks, and the tertiary level, like located in co- metropolitan cities. Right. So these are the way. This is a system. This is a pattern followed by both public and private sectors. When we talk about the public sectors, right, we have a different schemes, mission to support the hospitals like Ayushman Bharat, right, Ayushman National Health Mission, like so on. Whereas private hospitals, they have a different insurance tie-ups. Through that, they are able to provide those facilities to the people. We have two category of healthcare systems. One is public, another one is the private sector. We will discuss the first thing about the private sectors. The key major role of private public sector is providing a universal access. Since it is monitored and run by the government, right, their service is open to all. It is not restricted only to a particular group of people, particular level of people. It's open to all, so everyone can able to access the government sectors, government hospitals, and the major primary level sectors where they are having to prevent and protect you and give a first aid, right, care for your hospital for the patients. And apart from that, central and state governments has established a national health programs where it covers different health mission activities like insurance scheme, Ayushman Bharat, controlled program, disease control program like AIDS, TB, and so on. And they are a major part of the right the territory level, and they are providing a very care and affordable healthcare services to the patient. But what is the challenges in the public health sector if you see? Right, fund. There is no frequent flow of fund in developing the hospitals. That's another important, one of the important major challenges faced by the public sector. Second one is gap, especially with respect to infrastructure development and the quality level, not taking care of the patient, right, at most gap, and having a lot of difference in the urban and rural level healthcare centers and clinics. This is the challenges that they can face in the public sector. But when you come to a private sectors, right, it is also accessible to everyone, and well quality and valued services will be provided with the help of the advanced technology, advanced mechanisms, all this thing. And every day, the private hospitals, the private clinics, research labs are coming up with innovative and creative ideas and medicines tracks for curing the problems. But their focus is only on the urban, not on the rural. Most of the hospitals, right, will be accessed by the people through the medical tourisms, right, through their pay their hospitals, farmers, well reputed, and they have a tie up with the various insurance companies and insurance sectors through that they can able to provide service to the public people. But they also have such challenges like they will be charging too much high cost for the healthcare services. Some of the hospitals may not be right followed proper regulations in taking care of the patients and not equal access to the peoples. It is depend upon like first come first serve or depend upon who's ready to pay the amount, who's ready to do the complete the payment, who's ready to uh, give a lot of right up confirmation on the services part of the hospitals, and then the fragmentation. So these are the major challenges faced by the private and public sectors. This is the comparison between the public and private. So as we discussed, public sectors mostly focused on right preventing the and bringing the care for the healthcare services, which is supported by the government and also is focusing on the rural and urban, semi-urban part. And infrastructure, we cannot expect that much. Whatever resource they have, with that resource, they'll be providing a service. Cost is free. Those who want to approach the government hospitals, right, the free, they will be providing a free of cost services. The challenges is no proper funding and infrastructure and overcrowding all this thing. And we cannot ensure on the quality also. But when you come to the private sectors, right, quality level treatment will be there, and they'll be taking a special care of the patients. Too much of charges, fees, right, other financial expenses. This targeting on the upper level and middle level income group people. The infrastructure will be well advanced and to be developed and more sophisticated kind of environment they will provide for the patient. And most of the time they'll follow the out of pocket model where individual has to bear their expenses for their treatment rather than going for insurance all this thing. Challenges is right since it's a high cost, people are difficult to get treatment from the private hospitals. Not all the people, only a particular group of people, and there is no equity in the right providing the healthcare services to the people. So this is the basic difference between the public and the private healthcare sectors. Next important thing is what is the challenges faced in this? As we discussed, right, we are following in our Indian country, we are following this kind of a services. But what is the challenges in that? First important challenge is low public spending, right? So if you see our Indian healthcare system, right? If you see global level, they are spending, right, limiting the public people to access this because the government's hospitals are right running without the proper financial support. Private hospitals are running right by getting a lot of right financial support or financial payment through the services. Second, differences in the urban and rural. You can see a lot of variances, differences between the hospitals located in urban and rural. That's other major challenges which is followed in our Indian healthcare system. And most of the times, whenever we move to hospitals, whenever we got the treatment, of course, we need to spend our own money. Whereas unless until if we have our insurance, we can read reimbursement. Fourth important thing is shortage of the workforce, right? People are not located or designated properly in the hospital, especially the government hospitals. And the last one is communicable and non-communicable disease. There are certain things that we have an awareness, but there are certain things we don't have the awareness because of right changes in the climate, because of our practice and the upcoming problem in the environment. All these things are right making us to not have an awareness about the non-communicable disease. So these are the major challenges faced in the Indian healthcare system. So hope this video is very helpful for you to understand the Indian healthcare system and their different services. Right. Next video, we'll discuss about the healthcare services delivery by the hospitals and what are different models on it. Thank you.